I will be speaking on one of the another technology we have seen the FECO, all type of the rings, femto, is the role of eye trace.
सब ये बीच वाली सीढ़ी जो है ना, बीच वाली जो एस्केलेटर है ना, इस बीच में वो अच्छा है, वो ऊपर नीचे सब तक जाता है। लास्ट वाला है खाली एक फ्लोर के लिए, तो बीच वाला अच्छा रहेगा।
Role of eye trace in detecting the correcting aberration in cataract and refractive surgery. I will going to cover on the cataract surgery, because it helps in the selection of the patients for aberration-free lenses, selecting of the multifocal IOLs, because that requires a premium cataract surgery is premium, which I all discuss. We have the IOL calculation, IOL master, FECO machine, premium IOLs, and aberrometers. Still, sometimes we have refractive surprise or unhappy patient. So there is a new concept, the eye trace visual function. It is basically ray tracing wavefront aberrometer and the corneal topographer. It is a 5-in-1 system, ray tracing, it gives the aberration, then corneal topography, auto refraction, autokeratometry, and the pupillometry. So it's 5-in-1. And what is the role in, what does eye trace do basically? It is given the aberration and the corneal topography. So basically is give the pointer, please, total aberration, and it gives the total aberration and the corneal aberration. So we just detect the total aberration minus, so you can get the internal aberration. How it is important? So we can evaluate the premium IOL, spheric, multifocal, toric, accommodative, and selection of that dysfunction lens index, whether the patient is a refraction increasing or the lens is a problem. You can have the DLI and post-operative evaluation of the unsatisfied patient. It is a pitfall. We have to head movement. Measurement is an important issue, just I skip. So this is the total aberration. You can give optical quality metrics and it gives the simulated. So these are the data you get, a retinal spot, how much a single spot make it is like that. How is your image you form, and which is a dilated pupil, it is 5 mm. Eye trace demonstrate actual vision problem patient is having. It gives angle kappa, angle alpha. So you can have the misaligned multifocal. So this is the option. This is the internal aberration. This is the corneal aberration. This is the total aberration. As there is a few corneal aberration, you remove the cataract, there is a removal of this aberration will go. So these are the good candidate for the multifocal lens. Suppose this corneal refraction aberration is high, and if you give the multifocal lenses in this is going to persist and the patient will be unhappy. So it decide, perform eye trace. This is the method what we are doing. High angle alpha. If you want to go consider monofocal, if there is no high angle alpha, you can go analyze corneal optical quality with change analysis. If a corneal high order aberration is there, you again go for the monofocal, not for the multifocal. If it is a low, you can go for toric candidate. You can go for toric multifocal, or eye trace, you can plan it. So in this way you can detect the customize, you can select the lenses, you can have the aberration. There is what we are mostly talking of the aberration free lenses, negative aberration. But what are the options? There are the multiple lenses which are negative aberration, zero aberration. Suppose that cornea is having positive aberration, we can put the negative aberration and it will neutralize. If suppose cornea is having zero aberration and we put the negative aberration lenses, we are creating the more aberration. So these are the fine tuning of the cataract surgery. You can select whether it is the option of the refractive ectasia is developing in the refractive surgery. There is a change in the refraction. We see that is the LASIK, the refraction is regressing, but probably there might be change in the lenticular changes which we can detect by DLI. So in short, this is about the eye trace and the cataract surgery. This will help to you customize your, this is dysfunction. You can see that there's a patient, his vision is 6 but the quality of vision is like this. So you can detecting this point DLI, and you can select and advise, and you can have the good reason. This is one of the refractive surprise we have. A 40-year patient, monofocal, both eye vision 6/6, and he has severe dysphotopsia. And this is the quality. With the 6/6, this is the quality of vision. You can see patient is pursuing, and literally he is having the dysphotopsia. These are with the 4 mm, this is the quality of vision. You can see there is a change, that there is a monofocal. This is indicating that you should change. So slightly because of the fibrosis, there is a tilt and creating the aberration. So in this, the monofocal, this is the monofocal hydrophobic lens, and we have just rotated it, and you can separated the fibrosis, so that, and this give how you can see that quality of vision is improved after the rotation. The both are having the 6/6, but the quality of vision is, patient is heavy. You can see what was the aberration previously and this aberration later on. So this proves that it can, there are other toric IOL, and you can select that quality of vision. This give you this much rotation is required, and this will be the quality of vision later on. So in short, this is about the eye trace. You can help in the selection of the lenses and assessing the unsatisfied patients.